Good evening and welcome once again. Today is our 1540th day of continuous webinar. Thank you all the participants for joining with us. And welcome all to today's session. Today's our guest is Dr. Javed Akhtar. He has already taken many classes for us. All of you know him very well. He is BHMS, BSc and BSc in Clinical Pathology and MPhil in Physiology. And he was ex-member of National Council of Homeopathy and ex-chairman of Professional Development Program of Homeopathy and many years of teaching experience. And well-known doctor and well-known teacher he is. He gave many knowledge to us. I am welcoming Dr. Javed Akhtar for today's webinar. You are welcome, sir. Please.
Thank you. Good evening. Assalamu alaikum. Today is the 1540 session of International Forum for Homeopathy. I'm grateful to all of you and especially International Forum teams, our respected doctors and homeopath well-wishers. Good evening. Today I'm going to present a case of the polycystic kidney disease. Basically, today I have selected a such case. This case is a genetic disorder. Normally, homeopathy claims we are doing, but actually, genetic disorders, as you know, it is manageable disease. It is not curative, is my own experience. However, I have treated this case. You can now I'm presenting the presentation of this case. The polycystic kidney disease treated by homeopathic medicine. This is the topic of this. The polycystic kidney disease, PKD. PKD is a genetic disorder characterized by growth of numerous cysts in the kidney. These cysts are filled with fluid and can enlarge the kidney while replacing much of their normal structure, leading to reduced kidney function and potentially kidney failure. Two types of polycystic kidney disease. One is the autosomal dominant polycystic kidney disease, ADPKD. The most common form of PKD affecting about 1 in 1,000 people worldwide. Symptoms typically appear in adulthood, age between 30 to 50 years. It is a inherited autosomal dominant pattern, meaning only a copy of the mutated gene is needed to develop the disease. Two main genes are, one is the PKD1, second is the PKD2. PKD1 is 85% and PKD2 is 15%. Pathophysiology. Mutation in PKD1 and PKD2 disturb the normal function of the polycystin protein, which may role in regulating cell growth, fluid secretion, and maintaining the kidney structural integrity. As a result, kidney include diffuse cells proliferate abnormally, forming cysts filled with fluid. Over time, these cysts expand, compress surrounding kidney tissue, reduce blood flow, and impair kidney function. The kidney can become significantly enlarged, often 2 to 4 times their normal size. Autosomal recessive polycystic kidney disease is the second type, a rare and severe form of PKD that usually manifests in infancy or early childhood. Inherited in autosomal recessive pattern, meaning both patterns must carry the gene from their child to develop the disease. Affected infants may have enlarged kidney and severe complications early in life, including respiratory problems. Symptoms of PKD is both of them. So, type of stage of the disease, but can include high blood pressure, kidney pain or discomfort, blood in urine, hematuria, frequent urinary tract infection, enlarged abdomen due to large kidney, declining kidney function, potentially leading to chronic disease, CKD, and end-stage renal disease. Complication, what was the complication over there? Chronic kidney disease. Many individuals with PKD eventually develop CKD, which can progress to end-stage renal disease. Hypertension, cyst in other organs. People with PKD may develop cyst in other organs such as the liver, pancreas, and spleen. Aneurysm, there is increased risk of brain aneurysm in patients with PKD. Heart valve problems, mitral valve prolapse is a common issue. PKD is often diagnosed through imaging studies and genetic testing. Ultrasound is the most common initial test used to detect cyst. CT scan or MRI provided more detailed images of the kidney cyst. Genetic testing confirms the diagnosis, especially in case with the family history or uncertain imaging result. What is the generalized treatment? There is no cure for PKD, but treatment aims to manage symptoms and slow disease progression. Blood pressures, normally they are HCC inhibitor or ARBs are commonly used. Pain management analgesic may be used, but caution is necessary due to potential kidney side effect. Treating infection, prompt treatment of UTI and kidney infection with antibiotic and is crucial. Dialysis or kidney transplant required for patient who processes end-stage renal disease. 12+10 and a medication approved to slow progression of cyst development in certain AD-PKD patients. Lifestyle and management tips: maintain a healthy blood pressure, regular monitoring and medication compliance are key. Adopt a kidney finding diet low in salt and protein to reduce kidney workload. Stay hydrated. Drinking plenty of water may help reduce cyst growth. Avoid nephrotoxic substances such as non-steroidal anti-inflammatory drugs unless advised by the healthcare professional. Another approach is a homeopathic treatment. Prognosis. AD-PKD, the progression varies. Some individuals may experience a rapid decline in kidney function, while others maintain good kidney function for many years. AR-PKD, the prognosis is generally poor due to early and severe symptoms, but advances in medical care have improved outcome. Symptoms of APKD. This is the autosomal which I have treated the patients. The onset of symptoms usually occurs between age to 30 to 50 years. However, some individuals may have an earlier or later onset depending on the mutation and other factors. Common symptoms include high blood pressures. One of the earliest and most common symptoms can lead to further kidney damages if left untreated. Kidney pain or flank pain. A dull itching pain in the back or side due to pressure of enlarged cyst. Sharp pain may indicate cyst rupture, bleeding or infection. Hematuria, microscopic or visible blood in the urine can occur due to cyst rupture. Normally, this hematuria is occurred due to the ruptures of the cyst or the kidney function. Symptoms of APKD: frequent urine UTI, commonly involving pyelonephritis rather than just the bladder. Kidney stones, due to structural abnormality, the kidney and altered urine composition, declining kidney function, progression gradually leading to chronic kidney disease and potentially end-stage renal disease in large abdomen due to significantly enlarged kidney. Extrarenal manifestation AD-PKD can affect other organs and systems in the body, including liver cysts, commonly develop in about 80% of patients, but are usually asymptomatic. Pancreatic and spleen cysts, less common but can occur. Intracranial aneurysm, a high risk of brain aneurysm which can lead to hemorrhagic stroke. Heart valves abnormalities such as a mitral valve prolapse, diverticulosis, pocket that form in colon which can become inflamed or infected. Now I'm come to the patient's. My patient's name is Yasir Irfat, age 46 year. Reference number this and 2001 January. Diagnostic autosomal dominant polycystic kidney disease ADPKD. This is a patient history. First, I'm going to tell here. Yasir was a well-known homeopathic doctor from district Cuttack, Punjab, Pakistan. Was born 1973. He got married 97. And following the death of his father in 1998, he assumed full responsibility for his family as the eldest sibling. He was diagnosed with autosomal dominant polycystic kidney disease in 2003 at the age of 28 years. He has two sons and had been under homeopathic treatment for 18 years, consulting various expert doctors without significant improvement. He first consulted me in early 2021. Then when his serum creatinine level was 3 at both kidney along with liver and cyst. Despite our initial consultation, a proper similium remedy was not selected at that time, and the patient did not return for follow-up. In 2023, conditions, what was the, after that, after 2 years, you can say, by 23, the patient condition had significantly worsened in after the 2 years. Serum creatinine level increased 8.57. Serum urea level 145, it was 10 to 50 milligram normal range. Serum uric acid level 8.4. Estimated glomerular filtration rate 7. Gamma GT 64. Urine reports, sorry, at that time hematuria. Ultrasound findings: left kidney cyst size 30 millimeter, right kidney size 40 millimeter. Kidney parenchymal increased abnormalities indicating diffuse involvement suggestive of progressive disease. Clinical outlook. Given the genetic nature of APKD, the prognosis is typically poor. However, after through the case review, an appropriate similium remedy was selected in May 2023. The patient showed noticeable improvement and managed to delay the need for dialysis through consistent homeopathic treatment. Note, despite the genetic basis of condition, positive outcomes have been observed indicating the effectiveness of individualization. Homeopathic management is improving the patient's quality life. Here is a patient version. What was the patient version? In his own words, 29 May 2023, name Yasir Irfat, 48 years. Doctor told, please describe ongoing issue. Patient, I have polycystic kidney disease. My kidney are enlarged and I have cyst in my liver too. When there is strong storm with heavy rain and loud thunder, I get scared. I worry about earthquake and imagine everything collapse. Doctor, how long have you had this problem? In 2023, sorry, 2003. Doctor, was there any specific incident in 2003 that triggered these issues? No, nothing. Nothing specific happened. Doctor, okay. How many family members do you have? Basically, this is a very important question. When we are taking the history, we can see number of things. Sometimes patient cannot say directly, but indirectly you can patient say when you are asking the how many family members. So here patient, my entire family is there, parents, brother and sisters. Basically, normally now you can, after this question, you can say they are living get together, all family members are living, or only husband and wife and children are family. This is the basically you can see the setup of the person's family. Doctor, when did you get married? In 97. Doctor, do you have children? Patient, yes, I have two sons. The elder one is 22-year-old. Doctor, what problem do you face because of this illness? Patient, mainly weakness. If I keep my arms raised for a short time, they lose strength. I can't walk much either. Doctor, what impact does this weakness have on you? Patient, I make me very angry. How do you express your anger? Patient, if it is someone under my authority, I might even beat them. Using abusive language is common when I am angry. However, I restrain myself otherwise because I know anger is not good. I also feel guilty inside, knowing it's my fault, but I never apologize, even if I feel I should to ease the situation. I tend to quite negative minded. I joke about things, but I don't like it when others do the same. In gathering, if I feel ignored, I mentally set a timer for 10 to 20 minutes to observe the person's behavior. If they still ignore me, I didn't show that I am upset. I simply make an excuse and I leave. Please listen carefully. Basically, what is the importance of these things? This is the patient's, I have mentioned it are my observations, patient history, patient status, and patient version. Now it is the capability of the doctor who how he can select what kind of symptoms you can take over there. This is the basically we are what kind of problems, what kind of mistakes we are doing when we are taking the symptoms. So this is a very important here. So the doctor has there been any change in your sense this problem started? Patient, I have become more serious. I used to be very laid back, but not anymore. Now people often ask me what has changed because I seem different. I went through a lot of stress, especially financial. I had to take care of my entire family. After my father passed away in 1998, there was 13 to 14 people are dependent on me. So all their needs, education and marriage were my responsibility. Doctor, when did this start affecting you? Patient, the stress began around 1998 when my father died and all financial responsibility fell on me. I promised myself that I would be a fatherly figure for my sibling and did just that. Doctor, how is your sleep and appetite? Both are good. Doctor, you mentioned a fear of earthquake. When did this start? Patient, it began in 2000. One morning while having breakfast, an earthquake hit. I ran outside in my nightclothes and watched the entire house shaking. Since then, whenever I think an earthquake has occurred in a while, on one seems to happen the same day. Doctor, do you have any other fears? Patient, yes, I can't stand the sight of blood. I started after my younger brother had a severe accident. I was having breakfast when someone told me he was lying injured on the road. I rushed out and saw blood everywhere. He was vomiting blood and seeing him in that condition shocked me. Since then, even the sight of blood makes me body tremble. So, doctor, what if you encounter someone in an emergency situation? Patient, I run away because I can't bear to see blood. Doctor, do you fear dialysis? Yes, I fear it a lot. I would prefer death over going through dialysis. I haven't seen patient on dialysis for years, living like lifeless bodies who cannot move, talk to recognize anyone. It's not a life worth living, doctor. Do you have any anxiety or worries about your condition? Patient, yes, I'm scared that my kidney might fail. And they already have to some extent. My son offered to come with me today, but I told him I could still walk on my own. Basically, his son is another country. Doctor, do you have any tension in your life? Patient, Alhamdulillah, no significant tension. Now I have good children, sportive sibling, and everything is going well. But I faced a lot of stress earlier in life due to family responsibility. Now I am free from the burden. Doctor, do you feel anxious about your test result? Patient, yes, I was very anxious while waiting for my test result. But when they came back normal, I felt relieved. I have strong faith in Allah's mercies. If it is my time, worrying would change that, would not change. So I try not to stress. Doctor, you mentioned that you tend to exaggerate situation. Patient, yes, I do. Whether it is something good or bad, I tend to overemphasize it. I'm also quite suspicious, but nature by nature. I don't trust doctors easily, as I believe many just experiment on their patient. That's why I could consulted Dr. Javed Akhtar, who I am just trust. Doctor, what is your expectation from that treatment? Patient, I just want to get better and I have hope that I will be cured soon. After seeing my report, I immediately came for consulting because I knew I couldn't handle the stress on my own for long. Patient, I also suffered from worm infestation, which I believe contribute to the liver and kidney cyst. This sentence he repeatedly 5 times. Patient, I am suffering from worm infestations, which I believe contributed to liver and kidney. So now I'm going to come here. Basically, when we are taking the symptoms, first though there are different methodology to take the analysis of the patients. If the patient who is suffering from chronic disease or genetic disorder, so here we focus not to take not current symptom, but as a whole we have to take the symptoms as a whole of the patient, because this is a genetic disorder, and it was started from the onset of the disease and what kind of issues over there. If you select the constitutional remedy, so it will work properly. If you select the current symptoms, because I took the history of the patient, he was taking the medicine according to the current symptoms. It will work, but it will work for the time being, not will work properly. As a whole, it will not work. So I have to focus in such cases. As a whole, you can take the symptoms. Here, difference when I of the version of the patient showed different type of the remedies. It can come phosphorus and different type of the remedies that comes if you take in different symptoms, but totality is not coming at properly. So you have to, therefore, the physician must know the disease. What kind of disease over there? If he knows, because genetic disorder or chronic disorders needs entire whole life of the patients. When it was started, especially in chronic disease or genetic disorder. So the history will start over there. However, I did the test, I took the rubric according date, because what you are focused about is, if you focus in the current symptoms, it will deteriorate, deviate you. So I took the rubric: fear, full of fear hospital going to, fear suffering of, fear death of, fatal end of disease, fear observe her condition being fear operation of each, anxiety, fear with disease fears, fear consumption of, anxiety dead with feeling of, anxiety darkened, anxiety disease about, anguish horrible things after seeing of hearing, like you see the issues over there. Anticipation dentist physician before going to. This is the specific rubric. Anticipation dentist physician before going to. Abhi still he is not going to, but dialysis there. Then I am routinely I am taking the rubric of this anticipation dentist physician before going to. So I am taken the rubric of this when the patient says I don't go to the dialysis because there is a lot of injuries and like this happening over there. Delusion and elation about to sink. Delusion, horrible, everything seems. Patient was also exaggerating, impatient discouragement with. Patient was impressionable, magnetized desire to, prejudiced, gossiping, impatient behavior, news, bad shock from, perseverance, stories frightful or sad stories, movies aggravation, fear, ascending of. So this is a basically analysis chart. I took the rubric. Then I'm going to say what kind of remedy I've selected here. It now it what happened in my 1 year. After the 1 year, then the patient was visited to me. At that time, the urea was 154, creatinine 8.9, GFR 7. Severely kidney impaired observed. You can say here end stage renal disease. At that time, patient was visited to me in 23. And after that, in the June 23, in the 3 month, after 3 months, patient was not so punctual because, as you know, the bad patient of the doctor is a bad patient. Understand? You might have with me. The doctor is a bad patient normally because he himself is a doctor. In September, the patient visited to me again. Urea 101 is reduced 154. Creatinine become 6.0 and GFR 11. Urine was at that time immature, now this is normal. Improvement, better kidney function, stable urine profile. In 17 September, then examine again 13 September, 30 September, it was creatinine was more reduced 5.52 and GFR 12. Ultrasound, at that time stone was present. Now the stone was disappear. Cyst normalized and stable kidney size. Size of cyst are coming reduced at that time. So, and kidney is working well. Status indication of stabilization. In November 2013, 13 November, creatinine become 5.65 and GFR definitely it was 11. And after that, 1st December, creatinine 4.92. It was more further reduced and significant improvement. Patient was normal. Here, after the 20 days, the creatinine increased 7.0. It is due to whatever I don't believe this report because in some time lab findings are not correct. Again, 7th of January 2024, creatinine 5.8. Then again in February, 12th February, creatinine 5.82. It was 11. The patient was feeling better and planning to. Now the patient was planning to go to Umrah for the Makkah Medina, and he visited over the status, stable kidney function and improved well-being at that time. So now overall summary of this: fluctuating kidney function, GFR remained between 7 to 13. It was a 1 year about treatment, indicating chronic kidney disease stage 5. Improvement, notable decrease in creatinine from peak level, reflecting better stabilization. Patient status, clinical condition with improved quality of life, indicating better physical and mental health, allowing plans for travel. Uh, when was the patient was visited to me? At that time, it was about to bedridden. He cannot move and here there a lot of definitely physically and level of that was so worst. After when I was selected the right simulum, the patient was absolutely normal. Everything is normal. He's going. Even he went to the Umrah. Now, what happened? Time of events: July, uh, August 2024. Here, family tragedies in July 2024. What happened? Sudden death. Yasser's mother passed away first, followed by his uncle a week later, and then his brother-in-law another week later. Emotional incident. Three deaths comes in the family. First is mother, then brother, and then brother-in-law. So emotional incident before his mother's death. This is a very important point. Before his mother's death, he was standing with the mother before it. She pointed at Yasser, his uncle, and his brother. They were standing in front of this mother, seemingly choosing who might go next. Just he says, the mother, who might go next? Now I'm going to die, and who will go the next? At that time, this left Yasser with the deep sense of impending doom, believing his own death was. After the 1 week, because the three was standing over there, after 1 week, one is gone, and secondly, then after 1 week, his brother, uncle is gone. Now, emotionally, he was said, now it's my turn, because mother says, so he believe it that it's my turn. So after in 3 or 4 weeks, they all are gone. Sorry, both are gone. Then in health, July, August, 28/7, urea become 97, creatinine 12. Creatinine was increased. It suddenly increased 12, and hemoglobin reduced. It was 16. Now it was reduced. Sharp increase in creatinine, severe drop in GFR, and indicated critical kidney failure. Patient was severely exhausted. In August 2024, rapid physical emotional decline. Uh, uh, 24 August 2020, Yasser passed away. At that time, he called me that my condition is so worst, and immediately passed. So, analysis. The sudden death consumed immense grief and fear in Yasser, intensifying his belief that he was next, which likely exacerbated his physical decline. Physical deterioration, acute kidney failure worsened by severe emotional stress, mild anemia noted, likely due to reduced kidney function, contributing factor to death. The emotional combined effect of end-stage renal disease, profound psychological stress from the loss of family members, hastened the Yasser's decline. So conclusion, Yasser's final month illustrate the powerful connection between emotional trauma and physical health, particularly in terminal condition. His rapid decline underscores the need for comprehensive care addressing both the physical and emotional aspect of chronic illness. May his soul rest in peace. Now I'm going to discuss the case, which is the remedy. I took the rubrics before my mindset, because I am going to take all those rubrics which are the constitutional type of, not current symptom, but as a whole. The patient, the patient repeatedly expressed dissatisfaction, saying, I have used many medicine. One thing, I have used many medicine, but none have worked for me. This constant repetition indicates a strong personal bias against treatment due to past experience. In homeopathy, repetitive language, this is identified as prejudice. This is a very important thing. Patient says that I have a number of medicine which are related to the, I have used all this. No medicine is working over there because I have experience over there. I know it. So here we can, what kind of, when the patient visited to you, at that time, what is the mindset of the patients is a prejudice. Okay. So I took the important rubric is a prejudice. And what is the interpretation of this? The patient has formed a prejudice viewed against all medication based on previous failure, showing a fixed mindset that nothing will help them. This rigidity reflects a deeply held belief shaped by negative past experience. Okay. Additionally, the patient emphasized a history of severe worm infestations, repeating this narrative multiple times. This shows a tendency to be stuck in a specific issue, reflecting their parochial focus, limited to their health problems without broader consideration of other possible cause or solution. The patient is also described as a family man who adhere to traditional family norms and values. This aligns with, because this is a family man. So here we can take the rubric prejudice to tradition. Interpretation. The patient's responsibility shows a strong inclination toward following family customs, norms, and preference for familiar, conventional ways of life. They drive comfort from tradition and are resistant to change. So, CALCARIA CARB is the constitutional remedy, comes in this way. The major important, the family man, traditions follow, prejudice, and all these things. CALCARIA CARB is an ideal remedy for the case considering its personality traits. Simple, here is the word simplicity and down to earth nature. CALCARIA individuals are simple, practical, and focused on the tangible aspect of life. They are not complicated or extravagant, preferring a straightforward approach to life and enjoying simple pleasure like family gathering, good food, and the comfort of their home. Family-oriented and traditions. CALCARIA responsibility have a strong attachment to their family and traditions. They thrive in an environment that provides security and consistency. They find comfort in following established norms and usually resistant to sudden change. Basically, this is a very important thing. CALCARIA personalities have a strong attachment to their families, and they are strongly attached to the traditions. One thing I have not mentioned here. His name is the Yasir Irfat Qazi. So I have asked. First, he told me his name is Qazi. If the someone is when you ask the name, what is your name? He will show their name, their caste. It means prejudice to traditions. The rubrics indicates prejudices. The CALCARIA CARB has a specific the CALCARIA CARB having such important symptoms because he follows the such norms. So at that time you can easily click over there because he told their caste first. Parochialism. and pettiness in Calcaria. Paracalisms, Calcaria carbonica often exhibit a limited scope of concerns, primarily focusing on the immediate needs and issues of their family or community. They tend to have a narrow worldwide, preferring familiar, close-knit surroundings rather than engaging with broader societal issues. For example, a Calcaria person may be deeply involved in local community matters, but show little interest in global events. This is a parallelisms. Pettiness. Calcaria carbonica may exhibit pettiness in the form of focusing on minor, insignificant detail. This can manifest as a concern overall small household issues like routine chores or minor discomfort. They may hold onto small grudges, not out of malice, but due to their focus on their mundane aspect of daily life. He told when I visited to someone, if he ignore me, I wait for 10 minutes, then immediately I left over there, I am anger. These are the basically pettiness, narrow-minded. When you are going to somewhere, someone's even not friend or whatever in a certain office, may someone is busy and you have a work over there. But what is the nature of the career is a pettiness. This is the pettiness of this personality. Why career carbonica? The simplicity, traditionalisms, paraquile outlook, and occasional pettiness align well the Calcaria carbonica constitutions. The patient's repeated narrative about an ineffective treatment reflecting prejudice, their adherence to family norms, and their narrow focus on their specific health issue indicate a Calcaria like a mindset. Thus, Calcaria carbonica was selected as the constitutional remedy to address both the mental and physical characteristics of the patient, aiming to bring balance and elevate their deeply ingrained pattern of thoughts. Thank you. Now, what kind of the potency I have selected here? Because one thing, definitely you have to see the chronic patients and such a fatal disease. So here you can select the remedy and very cautiously. And after that, the potency is a very important role. So how to use the remedy and how to doses over there. I have used the Calcaria carb 6 centimole scale, and it works, and I have used in water. Once a time, if the patient take directly, the patient was showing the aggravations, medicinal aggravation. The homeopathic aggravation shows over there, not a medicine, homeopathic aggravation. At that time, and thus I have used in water even in dilution in 3 glass. I play two drops and take the 3 glass. In 1 glass, I put the 2 drops, then in second and third. And initially, I used this medicine in a week, single dose in a week. And this was the dose. And sometime at that time when the creatinine was elevated at 7, at that time I used the 200 potency. Again comes 6 potency. Here I used LM potency, but it did not work over there. Again, it was Calcaria 6. And Calcaria 6, the remedy, after that, when he was being stable, it was used in 2 weeks once a time. Okay. Now, the very important issues here, the patient has died. it is died due to the renal failure? Baseline cause over there, but it was not the actual cause of renal failure because patient was absolutely stable. He was going normal. Everything is going to better improvement. He was everything. Suddenly, emotional grief was over there because when you having any problem over there, it was triggers you. At that time, it's triggered, and immediately kidney become worse. And after that, when it was worst, I used the medicine high potency, but did not work in low potency at that time. But didn't work. I told the patient, go to the dialysis. Once dialysis over there, the creatinine become normal. Even then, patient was not stable. If it is a renal failure, it is due to the cause of the death is a renal failure. But after the dialysis, the levels, all the chemistry of the patients was become normal. Even then, the symptoms and lethargy and weaknesses, anemia, nothing was normal. Patient was too worst. So at that time, patient showed to me that because I have to die. So it means now I come to the conclusion that death is not necessarily to the relevant cause. It may happen with normal person or abnormal person. So in this case, death is not the cause of the renal failure. This is my observation of this patient. Thank you to all of you. You can ask any question, please.
Participants, please raise your hand and ask question to Dr. Javed Akhtar. If you have any query about this case or regarding this, you can ask, please. Any questions in the chat box? Some questions in the chat box. I have a patient, creatine 10, depend on dialysis bi-weekly from more than 2 years.
So definitely, Dr. J. Prakash, you are giving me information. Definitely, you know it in homeopathically, you have to see the patients in full. You have to give the time, then you have to select the remedy. Not as you know, in homeopathy you cannot treat the patient disease. You have to treat the patients. This is a thing. Here is the sir mentioned, can it be ancient plant remedy for the patient with rigid and prejudiced adherence to old traditions? Sir, I could not understand what you are basically asking. Gee, anyone else?
Ancient plant remedy for patient with rigid prejudice adherence of old tradition. The ancient plant remedy, patient with rigid prejudice adherence. Maybe Harinath is here. If you are here means you can ask directly. If you are raising the hand means I will unmute yourself. Okay.
Dr. Dadra used here, why use higher to low potency of CALCARIA CARB? If Honeyman, if you read the Dr. Honeyman, he told that normally one thing you have to, a very important thing, especially in where the pathology is very deep pathology, you have to go to the low potency. If it's the mind symptoms, just then you can use the high potency. Because in certain grief or tension over there, then I use the high potency. So here I have seen basically it is a saying by Hahnemann. He used low potency. Even after that, if the patient works, even then he is go to the low. So low potency is working very well and very good.
I think the Harinath's question is those who holding their traditions, no, for
Yes.
that kind of patients, it is action plan remedy is good or like that.
Yes.
Because those who are believing and holding the old customs, the action plan remedy is good for them. Maybe like that. I don't know.
CALCARIA CARB is the one of the remedy. Is prejudice to traditions. They follow the traditions, old customs and traditions.
So the
Definitely,
cause of the death is because of fear, right?
it's not a death of the renal failure. It's not the cause of renal failure.
Okay, then anyone else? Dr. Muhammad Ali.
Assalamu alaikum. Good evening. Today, once again, a very nice learning series of homeopathy, IFPH, which promote homeopathy globally, day to day, updating the homeopathic doctors and learner student throughout the world. And as well as great mentor, Honorable Sir Dr. Javed Akhtar, great energetic homeopathic approach of different type of cases. And once again, today, a very nice case of polycystic kidneys in allopathy. They treat by dialysis from the year to years and suffer so many problems of the patient. But in homeopathy approach by cycle method, at the different aspect of the life and very nice approach of homeopathy and different type of symptoms and version of the patient, which reach the accurate point of healing of late Yasser Arafat, which a critical case of renal failure and polycystic kidney, and all the time the patient is covered with homeopathic medicine, but there is some emotional incidents and that he dies. It shows that homeopathy work is a best of the whole system. I appreciate to Sir Honorable Mentor, great mentor, Javed Akhtar, and congratulate to all of IFPH team which promote homeopathy day by day. Thank you, sir.
Thank you. Thank you.
Thank you. Thank you, Dr. Muhammad Ali.
Here, one thing I'm going to mention here, basically, how much homeopathy is a beautiful and what a wonderful system of treatment. If you select right simulum, you can do much of them. As you've seen in this case, basically here you need dialysis. Here you can't do it anything. A homeopathic remedy is working very well, and it will work same like the dialysis. It means it is not a compulsory that you can cure the patient. Basically, in such cases which are fatal disorders, if you can treat the palliate the patient or quality of life you're improving, it means you did a lot. So if the patient was, as my opinion over there, if you treat at the early stage, I think it's my approach. I can handle the patients very much better, because normally patient is himself is a doctor. The doctor is the bad patient. He is not caring himself normally. So if he visited to me again properly, I can do over there. However, my suggestion is you have to the homeopathy treatment is the best in the sense of, if you select the right simulum, don't go to the doctor. Don't say doctor doesn't know. It may sometime he cannot select in first visit or second visit and third visit. He can select right simulum in after 1 or 2, 3 visits, because he will take your history in again and again. Once he reach the right simulum, your problem is going to be solved. Thank you, please.
Thank you. Dr. Naveed Awan, please unmute yourself, doctor. Okay, you can ask now.
Hello, sir. Good evening, and good evening to all the respectable members of the IFPH and all dear participants. Very thankful to Sir Javed, who presented a very beautiful case today. And no doubt, Sir Javed not only depicts all the aspects of the case, but managed the case very beautifully. Case was near to recovery and going very smooth.
That time Dr. Naveed
But
was with me. We were both was handling the case. Okay.
Yes.
Thank you,
So
Dr.
he is
Naveed.
today. I also got the shock because he was our best friend, and may he rest his soul in the peace. He is real a good friend of mine and Sir Javed. And my words are not with me while expressing it, because we cannot forget him. He is a true picture of the CALCARIA CARB, no doubt. True picture. And if he is alive today, you can see that every word of the Dr. JAVED AKHTAR will show that what is CALCARIA CARB. And it is the expertise of Sir Javed who picked the right medicine of CALCARIA CARB, and the patient was on the way to recovery, but a trauma changed his life. And we mostly joke that when he say to us that I am going, now my time is near. And we mostly, why you are saying like this? And he expressed it very in a jesting way, because my mother said, now it's your turn. So he is no more with us, but he is a very, very true picture of the CALCARIA CARB.
I'm asking, not regarding the case, not regarding the case, because of my curiosity, I'm asking how the 3 deaths occurred there. It is due to any disease?
No disease. Nothing
Just
disease.
wait 1 minute.
Normal.
Just, sorry, sir.
As mother was definitely, as mother was definitely, she was too much age of this, but other was normal. Other was normal. As brother-in-law was normal. They are normal. They have nothing any disease. They are accidentally. They are suddenly dead.
Okay, then. Okay, thank you so much, doctor. And now it is a time for the Malayalam session. Every day, Dr. Javed Akhtar is coming and presenting one case and teaching that case and remedy to the complete team. Thank you so much for your presentation, and thanks for coming. Come again and teach us more. Thank you so much. English team, see you the same time tomorrow. Now we are moving to Malayalam session. I am inviting Dr. P. Shaila for moderating Malayalam.